Blarla. Hello peeps and welcome back to Project Hospital. Welcome back to Infectious Diseases Insurance DLC. Yes, indeed, we are working through the, although it's green, suggests good thing. Oh, we've just finished some procedures for Peter Smith here. Oh, that's lovely indeed. So, yes, we are working on the insurance. There's two insurance policies that came out recently. We will be doing the traumatology one, but for now we are concentrating on this one, which was designed for the infectious diseases, even though we haven't really done a lot in infectious diseases for this insurance policy, but we won't worry about that. So we are currently 2 out of 5 days without losing any patients. That's rage quitting or having them dying, of course. So we want to avoid all of those things. We are in the midst of nighttime shift. So what I'd like to do is at night time in my hospital, what I like to do, which you may know, is I've forgotten how to do it. How much have I played this game? Hundreds and hundreds of hours, and all of a sudden I have no idea. We want to look at all hospitalized patients in each department and just check them over, you know, doing the doctor's rounds. What is this? What is this? My goodness, a lab procedure has uncovered Queensland tick typhus. Oh dear, okay, well, we must get her dealt with. Good, I suppose. Now, I'm assuming she might need to be hospitalised. She's also in the wrong department. She's in general surgery. Let's send her off to infectious diseases. It's nice to actually get something that's infectious diseases. I'm assuming she is going to have to be, I don't know, let's try. Let's just send her to the GP for that. So time to do the rounds. We're in emergency. We have a Susan Hall. Hello Susan. She seems to be having an awful lot of... Who's doing the differential? She seems to be having an awful lot of tests, doesn't she? Let's have a look here. Let's pull the patient list down here. Let's put symptoms up here. This is where I like to have my symptoms. We know this to be true. Okay, so they are now sending her for a CT, apparently. As far as I can see, this is the wrong kind of CT. We're going to take over this one. There's clearly some crazy stuff going on here. She doesn't want to be having this kind of CT. We actually need one of these. This is what she actually needs, and it'll differentiate between these two general surgery ones, and the serologic testing which she's having done will also let us know if it's this. So yeah, we're going to, I think, take over her for now because there's something crazy going on there. Let's have a look. So Patricia White then for this department is also, she's just going for an angio. We do seem to have some heart issues going on here. I notice lupus there. Has she had an evaluation? She has. So it's not lupus. That much we know. So it's definitely going to be a cardiology thing. She's having the angio now, which is probably going to help find it because all these things, I think, are angios, except this last one here, which was an ECG. And she's had an ECG. She's had heart monitoring. So I think we're probably about to discover exactly what's wrong with Patricia here. And what I would like is, yeah, for her to go to cardiology. So we will make that happen. We now know what's wrong. So this should be simple enough. Let's do the rounds in general surgery, shall we? This gentleman is looking fine. It would be nice if he had 5-star comfort, but there's nothing we can do to improve that. But he is stable, which is the main thing. We do have some abdominal issues here. Oh, look, Susan. So stool analysis came back. Yeah, that's fine. Also, can we give her something to bring her fever down? That would be fantastic. She's not getting the chance to eat or go to the toilet or anything, so she's pretty unhappy. So Jennifer Anderson, oh, we've seen her before, haven't we? Seems to be absolutely fine. Lovely. What have we got going on here? Again, seems to be largely okay. Have we done on this one that blood? Because okay, I think we will just do it. I've got to learn where it is in here. It's going to be that one. Let's do that. I'm assuming we had a physical after surgery. No, it's just that I'm aware that we've got unfound symptoms here, which is making me a little bit nervous. We've done abdominal. We did an interview. We haven't done the CRP, which we could do. Apparently it was negative for this, but we have had a surgery, so we're just going to do a couple of bits. Might also take a blood pressure on that one. What is this? Okay. She was having another test. She's still going to chair. Okay, that's fine. We also want to bring her temperature down. So, where are we then? Jordan seems absolutely fine to me. Dana. Okay, it's a shame that she's not got more comfort, but there's nothing I can do to fix that. Richard. Okay, Richard seems good. Yeah, seems absolutely fine. Did we confirm this with the USG? We've not. Shall we do that? Shall we do that? Maybe we should just confirm this with the USG. And have we done a urine analysis test? We have. Okay, that's fine. Good. What have we got here? Richard White. Absolutely fine. Yeah, just needs to be left alone so he can get his other stats up. That'll be great. Barbara's fine. Karen seems sort of unfinished, doesn't she? But they've got stuff going on here, so I'm sure it's going to be fine. Good. Right, internal medicine then. This all seems to be fine. Let's just give him that, even though his comfort's okay. Susan, another test has come back in. We're just working through that. It's this test we want to see, and possibly do this CT as well. That would be nice. Okay, so Karen Clark seems fairly okay. I'm still going to give her these to bring this down all the same, even though her comfort's up. I mean, she's really good shape all the same. James Lee. Shall I bring this down so we can see them? It's quite a long list, isn't it? Let's get rid of this. The times are all wrong on that anyway, in terms of they're very mixed up between 24-hour and 12-hour clocks, and it's just very weird, very confused setup. I mean, this doesn't even exist, this hour, so it's really weird. I find it very bizarre to look at. Okay. Yeah, can't make James any more comfortable. Paul. Now then, we can certainly make Paul more comfortable. Look at this. We've discovered all of the symptoms. Let's help with the breathing. He does have a chest injury. I'm honestly not sure. We might actually make his comfort worse by doing the emergency care, but I think we should do it. Right, a patient has collapsed. A patient we've not got to yet. My goodness. Right, we're going to take over this patient completely. We want to get a defib on there and some beta blockers. This patient, this can be done in a GP office. That's fantastic, isn't it? That is absolutely fantastic. Her comfort levels are up. Let's deal with the muscle pain. But otherwise, I think she is good to go. So where were we? Yeah, it's probably going to make him a little bit worse, because I noticed that the chest injury's only got a -1, whereas emergency care will offer -2. So, yeah, we'll get rid of the chest, the breathing problems, though. We'll neutralise that, so it'll probably remain about the same. So this is pretty bad. But he has received his thoracentesis. So, right. Well, that helps us. The serologic came back negative. So we know now with Susan that it's not this. It's not this. So it is one of these two general surgery things. So it's just as well we've sent her in for this type of CT, because that will whittle it down for us. Fantastic. It's coming along nicely. What have we got going on over here? This gentleman is very happy. Okay, all good there. What have we got going on here? This all seems fairly good. We could do with, yeah, shall we give her some antibiotics? And she didn't like, does this have a positive boost? It doesn't, right? I think that's as high as we're getting it, because she's got some discomfort from this active treatment, or this is not active at all. This is a treatment that she's had. It's successful, it's been done, it caused her discomfort. There's nothing else here that I can give her to rid her of that discomfort, which is a bit of a shame. Lisa, hello Lisa. How are you? It's not the best, is it? But you're fairly comfortable, so I don't think we need to worry about these other bits here. We do have some hidden symptoms still, but we know it's not the bacteria thing, so that's good. She's had an MRI. So we've done this. Yeah, I mean, it looks like we've not done that, but otherwise, I think we've not done speech listening. But yeah, I mean, otherwise we've done what we can here. I think might give her the oxygen. What is this? Here we go, Susan. Excellent. There we go. We have the answer for Susan. So Susan can go to general surgery. Actually, wait for her to get back before I do that. I want her to go to general surgery. Get her out of observation. Hey, so where were we? Don't know. Lisa, that's where we were. Brooke, what's going on, Brooke? Ugh. She's fine. Totally and utterly fine. We could, by doing recommendations, just improve her discomfort a little bit so she's a bit more comfortable. What is this? So, this lady that collapsed. So we've done the DFib. We've given her the beta blockers. Now, she's actually had quite a lot of tests here. Not seeing an angio, but we're seeing a lot of cardio stuff here. So I think what we might do, she's actually in emergency as well. We could do, there probably isn't much point now in doing heart monitoring, because I think it's all largely been found. But let's do it. Let's also do an urgent echo as well. Yeah. Let's see what that does, and then we'll look at doing an angio. Lovely. So we were somewhere around here, weren't we? Yeah, okay. So Brooke is done as well. Great. Internal medicine. So let's move on then. There was quite a lot in internal medicine today. Interesting. So in orthopedy, everything seems to be okay here. Frank, a little bit of damage, but otherwise you're okay. Casey, yeah, all good here. Yeah, right. Are you back? No, not yet. Just saying that another test is coming. They've run billions of tests on this woman. Right, so that's orthopedy. Now, look at cardio. Wow, this department. Wow. Okay. Good. Let's see. They're fine. You're good. You're good. We'll deal with Dana in a moment. What's going on here? Are you back? Oh, you've had your urgent echo. This is the woman that collapsed, right? So nothing new found here. So what we're going to do, I think now is, I'm probably going to, no, I was thinking I might send her to cardio, but you know what? I will just send her straight for an angio from here. think that's what we'll do. So, Dana. All good. Excellent. Christopher Lee. Fine. Let's attempt to get some rest, though. Thomas. Lovely. Joseph. Is good. Okay. Also, we've got a new patient coming in. We need to go and see Michael. Fine. Jane. Jane. I mean, she's okay. She's okay. Jane. Excellent. All good here. Peter Smith. I'm happy with Judy. Okay, excellent. Now we'll come back to that. Who's just come in through here? Oh my goodness. Oh my goodness. This is terrible. So I'm sure they're going to do a perfectly good job though. Before, I don't want them to send them anywhere. If we could just do the physical and the heart monitoring, that would be great. Do that first. Might as well do an urgent echo. It's probably a waste of time. Might as well. Right. So we're getting there. We're working through it. Okay. Hospitalized patients, neurology. They are as good as they're getting. Same here. Wow. Can we put a bandage around their head injury, please? Stop the vomiting. Tell them to get some rest. Wow. Poor Frank. Even though he was saying he was comfortable, I'm not comfortable with this situation. Too much suffering was going on there. Otherwise, the rest of them are looking fine. Lab procedures have come back. There's the angio. Thank you very much. Okay. Send her back. Right, infectious diseases. So, I mean, everybody's looking pretty good, but I just like to do the nightly rounds, as you know, to make sure that everybody in the hospital is as good as they can be. And I would say that we are pretty much there. We can see that the comfort isn't quite as high as it could be, so we're just going to give her those painkillers, just to try and make it a little bit better. Rest. What is this? We found an irregular heartbeat. See, I'm pleased to ask for that heart monitoring. Let's they've also got respiratory failure, we've discovered. So we're going to get them on artificial ventilation and beta blockers. Let's also do the emergency care on this open wound. Let's do that. I'm pleased to ask for it, quite honestly. Charles here. Let's get some rest. Casey, fine. Lisa, good. Yeah, so I think not going terribly well down there. Let's pause this for a minute. Why are they not dealing with him? Why are they not dealing with him? Do we really need this? Don't know. I suppose that's what will actually confirm that she has this. Highly contagious. They are in isolation, so that's good. Some rest for you, for sure. We really need to bring this comfort up. Otherwise, I think they're doing it. So, oh, and then traumatology. Let's just have a very quick look through traumatology. Not too many people here. This department needs to do better. There is no doubt. What are you complaining of? Yeah, I don't think I can fix that for you. No, I can't. Right, okay. Fine. Oh. I'm gonna keep an eye on this one. Definitely need to keep an eye on this one. Yeah, we haven't even had we've had previous physical. Oh, she's had numerous surgeries. Okay, yeah, gonna keep an eye on her. Good, right. So, well, not so good for this chappie. So, who is available here? Oh, somebody is about to leave the clinic, so I haven't checked walk-ins, to be fair. haven't checked walk-ins. What do we suppose this could be? Let's have a look. I think I'm going to... Oh, mind you, they have sent her on this department. She hasn't had this test, but they are testing for stuff in internal medicine. I think I'm going to move her to internal medicine. And I would like to hospitalise her. We're going to give her some bits and bobs. Just so that she's not sitting there. Right, he is looking pretty rough, this guy. My goodness, he is looking rough. Do you know what we might do is also... Yeah, deal with that guy. Okay. Fine. Right. Oh, somebody else is about to leave the clinic. My goodness. This lady... right, can we... I think maybe this can be done in the office. I think, maybe. How do we... I'd like her to... Yeah, there's no doctor there. There should be. They're probably just fulfilling needs. They're going to chair. Okay. Anyway, I think we're okay. We're doing all right here. I think nighttime shift's going fairly smoothly, to be honest. It's really hit the fan for Richard Allen. He's now in the ICU. They seem to have just completely ignored him. Down in trauma. We're trying to stabilise him now that we've moved him up here. Okay, we could really do with getting him on the artificial ventilation, getting him those beta blockers. We need to close that open wound. Can we do all of these things before he dies? We've had heart failure. I cannot believe this. They have put him on the artificial ventilation, but that isn't enough. Now they've just walked off. A little bit concerned. Little bit concerned. Oh my god, it's happened. Right, okay, we've managed to get him all the bits that he needs. Right, let's get him into surgery, please. Oh, she's just doing the emergency care. He's got the beta blockers. So we are... Oh. We are getting there. But yeah, just need to get him into surgery. New day starting. Patient starting to come in. We've got Frank here, looking a bit rough. Going to send him through to orthopedy straight away, I think. Put him on a blue alert. Yeah, let them get on with it. He's looking a bit rough as well, isn't he? Do you know what? We might send you straight through to... That wasn't quite the one I wanted, but there we are. It's not quite the one I wanted at all. Oh well. He's looking rough. Don't know anything about him, so we're just going to put him on blue alert. Another one. Mind you, they haven't been to reception yet, so we might find out about them. We might just yet find out. Oh. Okay, they seem quite convinced. I'll tell you what, we definitely need to get... we're going to put them straight into bed, ECG them. Okay. Has an airway infection. That's not nice. This guy... Okay, yeah, no. Still haven't been able to whittle it down. But that's where we are. We are just working through... Oh, and Richard had his surgery, right? Richard had his surgery. Look. Oh, yeah. Yep. So we're definitely going to want to do a physical. I think we are also going to want to do the ICU blood test as well. Blood analysis as well after that. Good. This blood analysis was clear. That's lovely. That's great. I think we've had a physical. Yeah, I think we had a physical and found nothing. Okay, good. I guess we've not had the USG just to finalise. I think what we'll do is get him in for a USG. Now that he's a bit more stable, and just make sure that that is all that's there. Yeah, this is interesting. Charles Anderson here. Ambiguous results. We've not done anything. There's going to be no clear diagnosis. Consider adding more diagnostic equipment, laboratories, or radiology rooms. This is very, very unusual. Shall we start with an interview and a physical? That might be useful. Oh, look. We've started to get some results. What's this? Control patient was stabilised and is now being moved to the responsible department. James Baker! Yay! Well done. He's being downgraded. That's great. He's no longer so urgent. This guy. Oh, look. Look at that. They're saying let's do an x-ray. What are we looking at here? We are looking at surgery. So, I think, yeah, so we're doing the physical. I think we are just going to take over for the moment. Instead of making him walk there, I think we will hospitalise him first. I think that would be best. We have been able to confirm all of that. That's great. Okay. Excellent. Oh, dear. Oh, my goodness. Wow. So we found some things here. Let's, we got a wound infection. So there was a surgical cut, which is bleeding. So we want to stop that. And we've got a wound infection. So let's deal with that. Also, we've got some pains. Let's give her some painkillers as well. Just to sort all this out. The reason I'm not improving my surgical teams at the moment is because I'm still trying to work on my department deep dives. And so I want these kinds of problems to happen in surgeries because it makes for those episodes being better and more in depth of problems that you can expect and how best to deal with them. So, but the problem is that my surgeries aren't working so well. So in these sorts of situations, it gets a little bit hairy. God, look. Christopher Jones has been rushed in here. It's all looking a bit rough, isn't it? So we definitely need to stop this orifice bleeding. So component therapy, blood component therapy. Let's bring down that temperature as well. That's not good. I think this guy, I think he actually collapsed out in the waiting room. So we can see he has infectious diseases. So he either needs antivirals or supportive therapy. Not entirely sure which. So with these dealt with, let's look through what we can do up here. Quick easy test without sort of doing blood stuff. It's definitely these. Okay. Right, yeah, we'll do that. See if this reveals anything. Let's just know anything. But then I think he's probably stable enough now to send 2 infectious diseases, and it would be nice to actually go there and spend some time there. So I think we might stick with Christopher Jones for the moment. Either of these highly contagious? No, so he won't need to go into isolation. Oh look, so he's got chest pain, so we know that it's Lassa fever. Look at this, which is just the antivirals, turns out. We're also going to give him some painkillers as well. I think we'll do that. But otherwise, I think he's probably fine. Shall we do some, just to confirm, let's do the PCR, just so that we can confirm that it is this. It's just nice to get it in, right? Yeah. We've done a physical, so we don't need to worry about this. So we're going to now send him to where he needs to be. Lovely. We had another one collapse. Nancy here. But we've done a bunch of tests. We've got it down to these 4, so we know it's infectious diseases. We've arranged an RT-PCR because it'll discover potentially 3 out of the 4 that are here. So this one test should do it. But that's all that we can do now on trauma. So I have now sent her 2 infectious diseases. We will Let's see. Are any... Yeah, see, now, potentially highly contagious. So I'm going to put her onto isolation as soon as she gets there. And Christopher here is doing all right. We're still waiting for his test results. But otherwise, I think he is going to be fine. And he is on our infectious diseases department. You know, it is here. We just don't see it very often. But here it is. It is in full swing. Charles is having his knee surgery. That's good. We've had another infectious diseases emergency coming. Quick, let's take control. She's unconscious, so they've already arranged to bring the temperature down. Let's also give her some oxygen. Oh my goodness. This is terrible. And we are going to have to put her into isolation. That's definitely a thing that's going to happen. Let's give her a physical. So it looks like we might need to look at her breathing as well. Let's check that over. Can't do any speech listening to check for confusion. What we will do though is start the test just to confirm this. I think it's always best. So we'll get the test started on that. Let's give her something to help her breathing issues. Oh look, Charles' surgery has all been done. He's not in the best of shapes though, is he? We can give him recommendations for the joint immobility. That will help. The actual knee injury itself we can't do anything about. We'll give him an ice wrap though, why not? But otherwise I think he is fine. So we're going to take this sample and then we are going to send her to an isolation room where we'll be able to give her complex antiviral therapy. Look, very important. So they've already arranged isolation. That's fantastic. We're pretty much getting through this day now, and it's been very smooth running. The hospital has gone quite nicely today. We don't seem to be having any major problems of any kind, which is nice. We can see we do have some people here in isolation. Indeed, we do. All along this row here, it can be a bit difficult to see them. This hospital is pretty rammed. Let's stop their vomiting. Oh, that's disgusting. But yeah, we've got somebody here as well. Oh yeah, look, we're still trying to work out what's going on with Nancy. But another day done, I would say. We're doing pretty well with this, I think. If you enjoyed the video, please like and subscribe. Thank you to all my Patreons for their continued support.